I'll request Dr. Arvind Morya to give his talk on a novel progressive polyfocal IOL to correct all types of the vision.
And thank you, AIOS, for giving us the opportunity for this wonderful instruction course. So I will be speaking on a new and novel progressive polyfocal intraocular lens that is a non-negative dysphotopsia, glare, and halos intraocular lens. So what you require of an ideal premium IOL, so it needs to correct all types of vision, no negative dysphotopsia, no glare or halos. It needs to be pupillary independent and no effect of angle kappa and alpha, and also it needs to be cost effective also. So we are doing a world's first clinical trial. So to prove any hypothesis, we need to do clinical trials, and the best one are the phase 4 post-marketing clinical trials to observe changes in the uncorrected distance, intermediate and near vision, contrast sensitivity, depth of focus, reading speed in a sample size of 278 cataract patients undergoing bilateral phacoemulsification procedure, single surgeon at an institute of national importance, and inclusion criteria 20 to 70 year, clear cornea, healthy macula, up to NS4 and minimum 1 month follow-up. So till now we have operated 47 patients and 94 eyes, 25 male, 22 female. So the best corrected pre-op to uncorrected distance and best corrected visual acuity in logMAR. So it increased from 0.5 average to 0.0 in 48 patients. 24 they had 0.1, that is 6 by 7.5 logMAR, and in 22 eyes it was 6 by 9. When we compare the post-op intermediate uncorrected vision, the computer laptop font size of 8 equivalent to intermediate 6. So in 90 eyes it was intermediate 6, in 4 eyes it was intermediate 8. And as we compared the post-op uncorrected near visual acuity using the Jaggers chart, so in the 90 eyes it was N6, in 4 eyes it was N8. So as we compared the contrast sensitivity as this study, so it has a fairly good this contrast sensitivity as compared to the other IOLs. Now coming to the depth of focus, it has an excellent depth of focus. I have never seen in any premium IOLs. It has an excellent depth of focus from plus 1.5 diopter to minus 3 point diopter. So the vision remains 6 by 6, 6 by part, or 6 by 9 between this range. I have never seen such a IOL. So we compared, this is one of the patient, you can see excellent depth of focus in a patient, Srimati Nanu Devi. I have taken the consent from her to show this image. So as we compare the other premium IOL, so it has the best depth of focus. As we compared this study, they have compared these 80 Lisa, iCryl CERT trifocal versus extended depth of focus intraocular lens, iHands. So as you can see in this diagram, so we have the best depth of focus in this intraocular lens. This study was published in Indian Journal of Ophthalmology. Now coming to the reading speed, so it has excellent reading speed of more than 200 words per minute. So in the 47 patients Autofocus Pro implanted, the patient satisfaction is 29 are extremely satisfied, 15 very satisfied, and 3 are satisfied. And not a single patient are complaining of negative dysphotopsia. And one patient just recently in our OPD has compared of glare, otherwise not a problem in other patients. So how it is different from the other IOL? So you can see in the first picture, it has a large optic size of 7.5 millimeter, and the overall size is 13 millimeter. So it covers, when we compare it in the lower picture, so there is no gap, there is no temporal gap, so there is no aphakic area of 10 to 20 degree, that is causing negative dysphotopsia because of the large optic size. And now coming to the L-shaped, this, you can see the haptic. So the 6 millimeter arc length contact area at the capsular back fornix. But we can compare the other premium IOL, only the loop tip is in contact at the capsular back fornix. So it gives a rock solid rotational stability. And there are two holes, so they needs to be superiorly placed. And how it works, what is the principle behind giving all types of good vision without negating the angle kappa and alpha, is because of the GRIN technology, that is gradient refractive index technology. So in the upper part it is 1.42, and when we come down it becomes 1.52. So in this way it is able to provide the best vision, the distant, intermediate as well as the near correction. So when we compare the data from the systematic meta-analysis, these are the highest order of evidences and the Cochrane review articles with results of our data. Autofocus Pro is the best unique polyfocal progressive and only ringless posterior chamber intraocular lens correcting distance, intermediate and near vision with no negative dysphotopsia and very less halos or glare. So this was the systemic meta-analysis. We compared our data with this study. My acknowledgement to Dr. Jagdeep M. Kakadia sir for this wonderful innovation. This IOL is now available in preloaded fully hydrophobic form also, and very soon toric version will also come. Yeah, that's what I'm telling. Hydrophobic version is available, preloaded, and toric version is also about to come. Thank you so very much.
Thank you very much, Dr. Morya, for the...
Any comments, sir? Kakadia sir, if I missed anything? What is the origin of this? Who gave you the inspiration? I think
the inspiration is right here, Dr. Ila, my better half. And actually, when she became presbyopic, she didn't want to wear the near vision glasses. So she started using Bausch & Lomb multifocal contact lenses, which if we have seen on slit lamp, we know that it's ringless, and yet it gives an excellent DI in distance, intermediate, and near vision. So she said that if Bausch & Lomb can come out with a contact lens like this, why can't they come out with an IOL like this? So me, RC and Ila, we went to Bausch & Lomb's headquarters in USA, and we said to them that you have Envista material already and you have the technology, why can't you make? So they said, they bagav us that it's impossible because there's air in front of contact lens and there's aqueous behind. Whereas in case of IOL, there's aqueous in front and vitreous behind, which have more or less the same refractive index. So air versus aqueous is 1 versus 1.336. So they said it's impossible. But she was after me that no, it should be possible. You have to find a material which will have a similar difference of index of material, index of refraction. So we started the journey. We talked to Contamak, and Contamak provided, they made a special button for us, and Lifeline made the IOLs for us. And the journey started somewhere in 2016. We finished the product by 2019, and it's already 5 years, and more than 40,000 IOLs have been implanted by more than 150 surgeons.
Congratulations, sir.
Thank you, sir.
For giving us this wonderful innovation, sir. It's amazing.
Thank you, sir.
So and also cost effective.
All thanks to her.
Thank you so very much, Dr. Ila Kakadia, ma'am.